Now, ladies and gentlemen, once again, I would like to invite here on stage Dr. V. Shanta, who shares with us the 6 decades of journey with the Cancer Institute. She's already expressed some of her views, flagged off some of the challenges which she has seen towards the healthcare, the kind of healthcare which we are providing, especially the 67 years, as she said, they have dedicated. She started from a very small healthcare center, and now today the Adyar Cancer Institute has grown in stature. And as she has also mentioned, it's more of the care and compassion and that human touch which they have been extending, which is making a difference. Yes, we have come a little way, but a lot needs to be done in the healthcare sector. We seek further her views, her guidance, and what approach especially the CSR, the corporates should be adopting towards reaching out to more and more people and making this healthcare more accessible, more affordable, more quality driven for more and more people in this country, making truly a healthier India.
Good evening to everyone. At the outset, my grateful thanks to the organizers of the meeting for giving me the opportunity to address a large gathering of people in the corporate social responsibility and the people, the awardees who have got the CSR award this year. Before I go on, I would like to congratulate them and at the same time say an award is just a recognition of the work done. It is not an end by itself. I think it must be a starting point, an inspiration to go further and further up. So I think one of the important things that all the awardees should do is to see that they increase and enhance their work. Having said it, I have not been involved in any major area of healthcare as such. I've been very, very limited area of cancer, which of course is a very, very difficult problem. And I represent an institution of 64 years old, started in 1954, founded by the great lady Dr. Muthulakshmi Reddy, a legend in her lifetime. The institution was started at a time when there was no perception of cancer at all. We were the first institution in South India at that time, 1954, and second in the country. The ethos laid down was that we take care of the underprivileged, because that was a period when it was started, we were under British rule, and everybody who got cancer, people did not know first of all about cancer. And the rich people, when they got cancer, they immediately took the flight to the Western world. And she said, no, we have to have everything here. The Tata Memorial had started functioning, and we started functioning in 1954. We started as a small cottage hospital of 12 beds, 2 doctors, and 2 nurses, 2 technicians, and 2 secretarial staff. Today, I can be proud say that we are one of the acclaimed good institutions of the country, with a bed strength of 550, very soon it is going to be 650. Out of this, 30% are totally free, where they do not pay anything. Only 40% pay us. The remaining 30% pay a very, very nominal amount. Can I have the next? Oh, I'll turn this side, I think. Pardon?
Need some help?
No, nothing. The next one, next slide. The institute today has a hospital of 625 beds, a research division, a center of excellence designated by the Department of Science and Technology in 2007. The College of Oncologic Sciences, the first in the country, 1982, introducing the concept of oncology as a super specialty. This College of Oncology, it was the first time that the word cancer changed to oncology, because cancer was just a disease. Oncology was the study of the disease, and we introduced the concept of oncology. The Cancer Institute was the first one to introduce the concept of oncology and created the specialty courses of DM, MCH, etc. in 1982. And it was much later, nearly 10 years later, that other institutions started the teaching program. The next one. The most important thing in the cancer care we found as early as 1954 was prevention. Prevention is better than cure. It is more cancer education, awareness, and screening. So I'll go to that a little later. Then we have the registries, the demographic and the hospital registry, acclaimed the best in the country at present. We have a hospital registry that has a lifetime follow-up of all patients that we have treated. As far as the demographic registry, we have innovated number of innovations which have been followed in all other demographic registries in the country. The next one. The tobacco control has been an area of our study right from the beginning, because we knew in prevention tobacco is going to be the most important, and control through various projects and anti-tobacco activities. Tobacco cessation clinics are held. I mean, we have trained people in many institutions. School awareness program, because any of the prevention programs, especially for cancer, it has to start at the school level. At the 10th and 12th class, we have to inculcate in the mind of the children that cancer is a hazardous disease. Tobacco produces a lot of hazards. We are talking of NCD. I'll come to that a little later. Next one. Very important, another thing, as far as treatment goes, technology has come. We have moved from an era of incurability to curability. Today, nearly 40% of cancers are not only preventable, but are also curable. Only thing is that we have to get them early. Normally cancer has a name, cancer is incurable. It goes, even in the medical fraternity, many people think cancer is something terrible. Need not necessarily be so. 40% of cancers are preventable. And once we are able to control them, because this has come with research. So research does not come overnight. Today's research may be tomorrow's treatment, as coined by our advisor. But we have to wait for other areas. But wherever we have found the cure, we have found the preventive methods, we have to see that we are able to convey it and pass it on to everybody who needs it. Now, palliative care has to come in as part and parcel of cancer control, because advanced disease is part of the treatment because of, again, lack of awareness. So, for advanced disease, this palliative care center houses at the present moment 50 beds, but we can go up to 100 totally free. The next one, and it is a donation from a major donor. Now, I talked about the Dharmashala, where we have to house our people with an attendant wherever it is needed. Everything is free. The next one. Next slide. Now, the cancer registry, as I was talking, we have the largest registry in the world. It covers entire Tamil Nadu. The ICMR-sponsored registries are all urban-based or rural-based. Urban is the largest, but rural we have a few of them. But this one covers the entire of Tamil Nadu, the largest in the world and the largest demographic registry, covering a population of 73 millions and a square area of 50,216 square meters. I think we are able to identify in these areas the rural and the semi-rural and a little more advanced people. where there is a differential pattern of cancer. And our prevention methods will depend upon which cancer is highest. We know in which district there is a high level of cervical cancer, in which district high level of breast cancer, etc., etc. We have also been able to show very clearly how education plays an important part in some of the cancers. Cervical cancer, which was the topmost cancer in Tamil Nadu when we started the registry, today has come down remarkably. Not only all over the country, cervical cancer has come down, basically a result of education. So these are areas that many NGOs can take on to see prevention methods by education. The next one. Now, this is what I have already told you. The next one. Now, the Cancer Institute, I believe, is a unique institution because it had a vision that preceded governmental action 2 to 3 decades ahead. A population screening program conducted by us led to the foundation of the first cancer control program in the entire country, the Kanchipuram Cancer Control Program. In 1968, the National Cancer Control Project started, the Government of India was in 1982. So we are far, far ahead. But we could not, again, I'm not going into it. We have to trace this history and all the details. It will not, I can't do it in 15 minutes. So all that I can say is that we started it, but nothing more could be done on that till much, much later. But that was the vision that we had at that point of time in 1960s. Next one. Now, similarly, oncology as a super specialty, which I have already mentioned. The next one. We have been pioneers in many areas of cancer control activity. The first and foremost is indigenous production, indigenous technology. Today, everybody is talking of Make India because the Prime Minister is saying Make India. We wanted it way back in 1962. We fabricated the telecesium unit with the help of Homi Bhabha with an excellent, far-sighted vision. Today, we don't have such people who can help us. 1969, we created the simulator with the help of one of the major radiation GE of GE, and then we did the brachytherapy. Every one of them were functioning till all the units started coming from abroad. And the minute something comes from abroad, people want it and they don't want any longer. As a matter of fact, I am sorry to say we had a very good biotechnology department. We had to close down the department for the simple reason we had no funding. We are a purely voluntary institution living on public support. We have a very small government grant from the government of Tamil Nadu. The next one. And one other thing which I failed to say is all these contributions have been done at a cost that would have been impossible when they did it by the government. And again, this is basically a question of motivation. The next one. All our projects the earlier one, which I have said already, it is relevant in the context of Honorable Prime Minister's Make India. Our bioengineering department had to be closed for lack of technical and financial support. Here, CSR can help a great deal, I think, and CSR funding, I believe, is enormous, not fully disbursed. That's what some people tell me. I may be wrong. But I think CSR can take on much of these technology, making indigenous technology. We should try to see that we are not looking westward for all that. Next one. Government and non-government divide, I mentioned. Unfortunately, it is there. We have had governmental support and non-governmental support. We have had, sometimes government is good, sometimes it is not there. But I feel based on the magnitude of the work and the importance and quality of work, I think the funding and support should be decided on that basis and not be politically motivated. The next one. Now, we had the voluntary institutions and the government, the Regional Cancer Center in 1976. We were the first regional cancer center in the country. And in spite of it, there is a lot of question as to why a non-government institution, all the other regional cancer centers were government supported, state supported. The question was, why should we be supported? Then, of course, there is a lot of questions. I do not want to go into that, but we were happy and proud that the government of Dr. Karan Singh was the health minister at the time. He said it will go because it has been decided by the committee that visited them. The next one. This is the statement, as I mentioned to you, the institutions thrive. It can be thanks to the government, it can also be in spite of government. In its 60 years of existence, the Adyar Institute has seen both kinds of governments, and it has grown both because of and despite them. Of course, also grows because of its inner strength, the people that drive it from within. Next slide, please. Moving on from the institute, because this happens to be a meeting on corporate social responsibility, I just thought I'll mention a few words. The health scenario over the last decades has changed enormously from control of communicable diseases with increasing NCDs. Of course, non-communicable diseases, everybody knows, most important being cancer, diabetes, cardiovascular disease, and others. Now, communicable diseases are controlled in all the developed countries in spite of all the available technology, knowledge. We have not completely controlled it. We still have the burden of communicable diseases, but have to face additionally the non-communicable diseases. Non-communicable diseases are essentially lifestyle diseases. What do I mean by lifestyle? I'll come to that. Now, the cancer burden from 493,000 in 1984, today 2020 is expected to be 134,000, etc. It increases 1% annually. Similarly, diabetes also is going on, is increasing. Both diabetes and cancer are lifestyle diseases and should be prevented. There is a small component in both of them which are genetic, and a lot of the frontline research today concentrates on genetic research in these areas. The next one. Now, cancer care to be affordable. Medical insurance, I think some of the things that have not been are being discussed very much at the highest level, but I think the implementation becomes a little difficult. It doesn't reach everybody, but it has been functioning fairly well now in Tamil Nadu. We have a good scheme, the Chief Minister's scheme. They are trying to do it in other areas also, but I am not aware of that, so I will not say anything. Now, medical insurance is the most important component of affordable treatment, and governmental support should be there. The major responsibility in this, I believe, is pharmaceutical companies to reduce cost. Reduction in cost is possible, I am told. And I think another very important thing, just like I said, humanity in case of medical treatment, avoid unethical marketing. This is rampant. I think I do not want to go further. A lot of pharmaceutical companies are helping us, but I think they should try to reduce it further. Medicine is certainly a difficult art, one inseparable from the highest morality and love of humanity. That was the statement made by Dr. Jones of the MD Anderson Hospital when he was translating the work of Hippocrates. I think the Hippocratic Oath continues to be as relevant today as it was 2,500 years ago. The other important people who are responsible and who can contribute to reduction in cost will be ethical practice and patient-centric decisions. I think when I mean patient-centric, whatever is in the interest of the patient, it cannot be physician-centric. I don't want to enlarge on it. I'm sure everybody understands. The next one. What can CSR do? Preventable cancers. I think that's the most important. The thrust today, technology has come to cure many of the incurable diseases, but prevention does not require any technology. So preventable cancers, we have 5 rural cancer awareness programs at where the Cancer Institute is doing it, one in Viluppuram, Pudukkottai, 5, and the Pudukkottai one has been declared a model center by the Government of India and has received an award. Every one of these is freely done free. The patients there do not pay, and wherever cancer is diagnosed, they come to the institute for free treatment. Now, the next is support institutions providing free service. That is what I would say. Not only technological improvement, but I think keep patients alive, I think is important. Continuing research is vital. Without research, we will be stagnant. Research is vitally important, and today translational research has come to stay, and I think much can be done in our own area. We are doing it at the many areas in India, but I think it must be supported better so we can get answers earlier. Next one. Well, I think I've almost finished what all I wanted to say. All that I want to say is the oath of Hippocrates, concept of service to humanity and respect for human life. I think that is going to be vital, and that every individual must know, every corporate must know, every medical person must be aware of it. The next one, of service, including Albert Einstein. He says, only a life lived for others is worth living. Value of what you, value of an individual is seen in what he gives and not what he receives. I think these are small areas of inspiration which have to move men and women on to service to humanity. The next one. That is Mahatma Gandhi. To do one's best is one's duty. It is our own reward. Service about self is service to God. Action is their duty. Fruit is not their concern. That is what Bhagavad Gita says. The next one. Thank you for the opportunity.
Thank you, Dr. V. Shanta, for leaving us with such an inspiring message, and also sharing the tremendous work which your institute has been doing more out of passion and love for the humanity, and also guiding what the CSRs, what the corporates can do as the CSR for the institutes like yours and the others, and especially in the field of cancer, in preventing cancers which are preventable.